Hello, Mrs. Kani. Hi, my name is Dr. Tayal. Nice to meet you.
Thank you.
I've been asked to examine your hands. Is that okay?
Yes.
Yeah. Just let me know if you have any pain or discomfort. Okay. So can I start looking at your hands?
Yes.
Okay. Can I just see both your hands, please? Just relax. Keep your hands relaxed. Right. Could you turn your hands for me now? Thank you. I'm just going to check your joints there. If they're sore, just let me know. Are they sore?
No, not particularly. But some days, particularly when it's cold, yes, they ache or cold.
Okay, and can you do like that for me? Okay, that's fine. Can you just turn your hands back again? There you go. Okay, thank you. Now I'm going to check some movements around your thumb and also check some sensations around your hand. Is that okay?
Yes, certainly.
Can you point your thumb towards the ceiling like that? Yeah. Keep it there. Don't let me push it down, okay? Just keep it there. Okay, and on this side, thumb towards the ceiling, keep it there.
Stronger.
Okay. Can you do like this for me? Bring your thumb closer to the little finger. Yeah. And keep it there. Don't let me straighten it. Okay. And do the same here. Keep it there. Don't let me straighten it. Okay. So that's pretty strong. And can you do like that for me? Touch your thumb with the little finger and keep it there. I'm going to try and pull it apart, but keep it there. And do it again for me. Okay, and this one. Okay. And can you bend your thumb like that for me? Okay. And don't let me straighten it. Don't let me straighten it. Keep it there. Don't let me straighten it. Okay. All right. Okay. I'm just going to check your sensations now. Okay. So that's a cotton tip.
Yes.
It's going to feel like that. Can you feel it?
Yes.
Okay. Now I'm going to touch it on various points of your hand, and I'm going to, as soon as you feel anything, you have to say yes.
Yes, I can feel that. Yes.
Now, which one can you feel better? This one or that one?
Yes, is stronger.
You can feel this better?
Yeah.
Okay. Now can you spread your fingers out for me? And I'm going to check on this side and on that side. Which one feels better? This one or that one? The first
one is lighter.
Is lighter
than the second one.
Okay. What about here? Can you feel this?
Yes, I can feel that.
And there?
Yes.
Are these two similar or different?
No, very similar.
Very similar. What I'm going to do, I'm going to tap on your palm.
Yes.
And see if you have any tingling running down your fingers and thumb.
Yes.
Okay?
Yes.
Do you have any tingling?
Yes.
And which fingers are they? Where do you get the tingling?
And the thumb and the first two fingers, mostly.
Okay. Thumb and the first two? Mostly, okay. I'm going to ask you to do like that.
Yeah.
Just bend your wrists like that for me. And put your elbows down slightly. Yeah. And just keep it there. And let me know if you get any tingling down the same fingers which you had when I tapped your palm.
Yes.
You're getting the same?
On the left hand,
On the
my
left.
thumb and first two fingers.
Okay, that's good. That's it. Thank you so much, Mrs. Khan. You've been very kind. My diagnosis for this patient is median nerve palsy on the left hand. This is evidenced by thenar wasting, weakness of the thumb opposition, abduction and flexion, sensory impairment over the lateral 3.5 fingers on the palmar aspect, and a positive Tinel's and a Fallon sign. She has got normal thumb flexion at the distal interphalangeal joint, making the diagnosis of a possible carpal tunnel syndrome likely. She also has bony swellings on her distal and proximal interphalangeal joint, but sparing of a metacarpophalangeal joint, with a possible diagnosis of accompanying osteoarthritis. Suspected carpal tunnel syndrome is not a very common station in PACEs, but it can be encountered. So it's important to keep that in mind while examining hands. Especially important is to compare both the hands to look at thenar wasting, which should give a clue to carpal tunnel syndrome, which should always be confirmed by doing Tinel sign and Fallon sign. And it's important to demonstrate the movements and strength around the thumb by checking the flexion, opposition, and abduction at the thumb. It's also important to demonstrate to the examiner that the lesion is at the level of wrist by examining a normal flexion at the thumb at the distal interphalangeal joint, which is supplied by the median nerve from a branch which arises before the carpal tunnel. It's an examination which should get you good marks. Two other important points that I'd like to emphasize while examining hands is because most of the patients are old, and if you find a pathology, it's quite easy to stop looking for other pathologies. So if a patient has an existing osteoarthritis and she has carpal tunnel syndrome, it's easier to forget the osteoarthritis. It gets you more marks to pick up that pathology, look for nodes in the distal and the proximal interphalangeal joints, and come out with that diagnosis as well. And once you arrive at a diagnosis of carpal tunnel syndrome, it will give you more marks to then start looking for a possible cause. So maybe patient has acromegaly, or maybe patient has rheumatoid arthritis or features of hypothyroidism. You should always be looking for those signs on why the patient has this pathology.